Next on Vox Africa, Aanu Michael brings you unique showcases on Nigeria. Now you're welcome to another exciting episode of the 411 on Vox Africa. I'm Aanu Michael, and today I have the lovely Princess Adepeju Hameed on the show. She is the founder of Seham Healthcare Foundation, and we just want to talk about the great work you're doing, right?
All right.
Yeah, thank you so much for coming on the show.
Thank you so much, Aanu.
Yeah, now let's talk about the mandate of Seham Healthcare Foundation. What's the mandate of the foundation?
Seham Healthcare Foundation is actually mainly focusing on viral hepatitis in Nigeria, proper advocacy campaign, and proper treatment support for people living with viral hepatitis in Nigeria.
Okay, now I know you have a medical background. So amongst every other thing, why did you decide, okay, viral hepatitis, is what I want to focus on?
Thank you for the question. It's a bit emotional thing for me.
Okay.
I've lost quite a number of family members, friends to viral hepatitis, and it's a totally preventable disease, and I was drawn out of passion to help the common man on the streets.
Okay. Now let's talk about how long you've been running the program. How long has the program been running now in Nigeria?
We started on a small scale in 2009, where we do community advocacy, community screening. And about 15 months ago, we got registered fully as a non-for-profit organization. And we became a member of the World Hepatitis Alliance in 2015.
Okay, now what about the programs you run? What various programs do you run under the foundation?
Well, basically what we do is hepatitis advocacy, preventive measures, treatments, and support.
You did a program recently in Ife.
Yeah.
I mean, it was really huge.
Yes, it was.
Now, why Ife? And then, basically, talk to me about the program.
Basically, we go into communities that are willing and have the support. In Ife, we have the support and willingness of His Royal Majesty Oba Adeyeye Enitan Ogunwusi Ojaja II and the wife. They became our royal ambassador for hepatitis advocacy. We had the support of the gastroenterologist in Ife. They all came out to support the program. We had the support of the media house. They were all there to cover the program. And Yeyelua Olori Wuraola Ogunwusi was there with us on the second day, the World Hepatitis Day itself, 28th of July, to do a walk with us. And that was the first time she would be walking out on the streets of Ife. And
oh my! Yeah. And it was for viral hepatitis.
Yes, that she would be walking on the streets without being in the car. She walked with us down almost to Lagere.
They must really believe in this advocacy.
Yes, they are passionate about the people. They're passionate about the youths. They are passionate about giving back to the community. And unfortunately, viral hepatitis will not manifest until when you've gotten to your productive age.
All right, let's talk about the various challenges you face on this job. The reason I'm laughing is because we've had such long discussions since last week about this advocates for viral hepatitis, the challenges you're facing, and maybe our viewers can.
It's a bit challenging because it's a new thing. It's not so new, but it's new to the media. It was first discovered in 1965, and that's why they celebrate World Hepatitis Day every 28th of July. It's so difficult because it's not catching the media attention. So the corporate bodies don't want to support. Well-meaning Nigerians will say, you're not talking about malaria, you're not talking about HIV. Nobody will hear me when I do something like this. So it's a bit of a problem.
Okay, so media challenge is a problem. What about fun?
Oh my goodness.
I always ask that question from every Indian. How do you fund this major operation? You know, it's a big deal.
Yeah, it's a bit. My husband said I have the heart of a gold. I have a good heart, because I can tell you that the event that took place in Ife, it's 98% funded from my personal funds, you know. So it's a big, big,
that's
big,
why you're
big.
one of the major champions.
Yes,
of
it's a
Nigeria.
big challenge. You see the common man on the streets cannot afford treatment, and we had over 3,000 beneficiaries in Ile-Ife, and we were able to vaccinate over 2,000, and we have over 168 people that are presently living with viral hepatitis, and I don't know what else to do. I don't know, because I can't take it all. It's a bit of a sleepless night for me, let me put it that way.
Wow.
Because now I've done the screening, now I have given vaccination protection for the people that do not have this virus. And so what happens to the people that are positive? Am I just going to leave them? Because the gastros have seen them.
Especially after letting them know their condition.
You know, the gastroenterologists have seen them, and they're telling me, they're calling me that, they decided to dedicate a special day, you know, for these people. And we also have a couple of people that already know that they have the viral hepatitis, but they don't know what to do. So it was like an eye-opener thing. They were like, oh, this is a time for me to come forward. So we have hundreds of people in Ile-Ife right now that have this virus. I don't know what to do. I know, but how to take them to the next stage is a bit of a challenge for me.
All right, so now let's talk about this 169 positive, you know, should I say indigents of
Ile-Ife.
Yeah, Ile-Ife. Now,
they are not indigents, they're actually indigents and residents of Ile-Ife. Okay. A lot can be done, but usually two scenarios can play. Is either they are in an active phase or inactive phase. If they're in their inactive phase, then we're talking about them being prone to infect their relatives, community members. And if they're in active phase, we're talking about down the line coming down with liver cancer, liver failure, liver cirrhosis, and definitely a liver cancer.
Let's talk about the percentage, because I'm looking at 3,000 people screened, 169 people positive. That's well above 5%.
Yes. In Lagos State, we've done quite a number of screenings since 2009. We have a huge data, talking about thousands of residents in Lagos State. And from our data, the prevalence rate is 8.9 in Lagos State.
That's very close to 10%.
Yes. And HIV is less than 5% nationwide.
Okay, now let me get this straight. How much of a threat really is hepatitis B if it's more prevalent than HIV/AIDS?
1 in every 10 Nigerians are carrying hepatitis B or C virus. It's 10 times more infectious than HIV.
I hope our viewers across Nigeria, across Africa are hearing that 10 times.
10 times more infectious than HIV.
Okay, that's huge. That's a very huge number. And we're going to go on a short break right now. This is still the 411 on Vox Africa. I have Princess Adepeju Hameed on the show, founder of Seham Healthcare Foundation. She is championing the cause to eradicate hepatitis. That's viral hepatitis in Nigeria. We're going to come right back after this short break, and we're going to continue discussing this. Thank you. Well, welcome back to the 411 on Vox Africa. I'm Aanu Michael, and today we are talking serious stuff, talking about viral hepatitis. Yes, and I still have Princess Adepeju Hameed in the studio with me. And we're talking about Seham Healthcare Foundation and the wonderful work you're doing.
Thank you.
Creating awareness, diagnosing people, trying to eradicate this thing.
Thank you.
Before we went on a short break, we're talking about the statistics of the people in Ile-Ife where you did your last program.
Yes.
You screened 3,000 people. We had 169 people positive. That's over 5%.
Yes.
We know this thing is infectious, especially 10 times more than HIV/AIDS. I'm scared. I'm getting screened immediately after we are done here. It's as simple as that. It would just be irresponsible, to not do this, really, if you can. Now, let's talk about statistical illustration, of how viral hepatitis kills, or data, of how many Nigerians are passing away from this disease yearly.
Unfortunately, we don't keep a good death registry record in Nigeria. But I can tell you quite a number of Nigerians are dying day in, day out of viral hepatitis complications, and a disease that is totally preventable with less than between 5,000 to 10,000 naira. You can actually get yourself protected for life, or at least 10 years. It's sad. The prevalence rate of viral hepatitis in Nigeria is about 11%. B, 11%, and C, it's about 2%.
Wow.
Yes.
That's a huge number when you're talking about the population of Nigeria.
In fact, it became so obvious to people that they actually have viral hepatitis when this HIV/AIDS program commenced, and quite a number of men were actually encouraged during the mother-to-child transmission program for the husbands to go and donate blood for their wives to protect their wives from contacting HIV virus. It's just like an advocacy campaign strategy. And most of them, they will come, they'll tell them they're HIV negative, oh, but sorry, you're hepatitis B positive, or you're hepatitis C positive, or you are HIV positive, you're hepatitis B positive, and you're hepatitis C positive.
All three. Yes.
In Nigeria, we have quite a number of people that are.
And what's causing this? People just don't get themselves checked?
Unfortunately, I think we mothers, I'm sorry, but mothers get to go to do their tests, go to the hospital, probably because we take the children to see doctors most of the time, so we get to overstress ourselves. But men, they will tell you, I'm fine, nothing is wrong with me, and unfortunately, people will start saying, oh, but I saw him. He was just sick for barely a week. It was okay, nothing was wrong with him. If they get to do postmortem and all that, that's when they will get to know that he actually died of viral hepatitis. I know that quite a while ago when I was in primary school, there was this yellow fever vaccination that was going around, one shot, one gun for several people. During this program, hepatitis was first discovered in 1965, and who knows what could have happened then. I'm not saying that's the cause of viral hepatitis, but from studies, we've realized that this is a virus that can survive outside human hosts. This is a virus that is 10 times more infectious than HIV. This is a virus that does not die immediately. It takes time, for it to die, even when it's not within the human body. So a lot of people has been
the probability of
a lot of people has been traced back, to circumcision, to incision, this protection that our forefathers used to do for us. A lot of people doing dental removal, And recently I had a friend, because most of my clients that are positive are now my friend, and she was sharing her story, and she told me that, Peju, you know what, I wish I can tell my story one day, because our own personal experience, according to her, was that she was fortunate to get screened when she was in establishment, but then she was a nursing mother, and she promised that she would take the vaccine later. And after the time, she got pregnant, she lost her baby, they had to have a D&C for her, And now she's positive. That's her story, you know. That's what she claimed, that she was negative before then, and now she's in active phase. She's actually under treatment.
Oh my.
Yes, and you know it's really expensive. The treatment is
wow.
It's a huge expense, and I guess probably that's the reason why the federal government does not have a budget for it, because it's a load. 2016 budget, there is none for hepatitis. You can prove me wrong. There's no budget for viral hepatitis. There's no allocation for viral hepatitis to say this is the budget that we have. It's
even
under,
if it's into research.
Yes, it's under
just for
others.
screening.
Hepatitis is under others from the Federal Ministry of Health. It's under others. So there's no budget assigned for eradication of viral hepatitis in Nigeria. You can prove me wrong. The federal government can prove me wrong on this. You know.
Wow. Okay, let's walk me through the process of preventing the disease, or how much does it cost to get the treatment, so that, okay, we are not giving all this to the federal government and saying, okay, you owe us, you know, as citizens of Nigeria, keep us healthy. This is huge. So even if the government is subsidizing, you understand, on some level, you know, how much does it cost for me to be able to say, okay, let me walk in, screen, and be sure I'm safe?
Okay, like I said, viral hepatitis is being transmitted with blood or blood products, blood transfusion, sharp objects, you know, unsterilized instruments, dental, hospital equipment, and all that. It's really expensive, you know, but I'll put a figure to it. It costs about 800,000 to 1.2 million to get treated with viral hepatitis. So you can imagine in Ile-Ife that I have 169 people, if all of them would have to go on treatment, I can't leave that to the federal government. So that's why we need corporate bodies, well-meaning Nigerians, to see this as a public health concern for everyone.
Okay, now let's talk about screening. I want to know my status. I may not be one of those who needs, you know, the 800 to 1.2 because now I'm positive. How do I even know? You know, what's the process or procedure to know?
All you need to do is just to walk into a medical outfit, tell them you want to conduct your hepatitis screening. If you're negative, they give you the first shot. A month after, you come for the second shot. At 6 months, you take the last shot.
Oh.
And a year after, you take a booster dose, which will protect you for a year, for at least 10 years.
Oh, okay.
And if you want to do the accelerated, although the accelerated was approved by CDC for expatriates, the question is, who are the expatriates? Expatriates are people that are coming into another country where they don't live in. And they said they should take the accelerated dose if they're going into an endemic environment. Tell me, we are already dwelling in viral hepatitis in Nigeria.
Oh,
so for me, I feel I might be wrong, but I from my own experience, people get to complete the vaccination with the accelerated than that of 0, a month, and 6 months.
Because they are thinking 6 months time.
Yes, 6 months time. We lose some people to it. So if you do the accelerated dose, which is the day 0, day 11, and day 21, and a booster dose after 1 year, just like the other one, we're all protected for at least 10 years.
And how much will that cost?
It costs between 5,000 to 10,000 naira.
Well, I hope everybody's listening to that. 5,000 to 10,000 naira. Put together all those stuff you buy, you know, in 6 months. That's just, you know, by the way, you know, all your, I don't know how to put it. You know how we waste some money on things you don't need, and just get yourself vaccinated. Or at least get to know your status.
Yes. Our intention is to go round the rural communities in Nigeria. We have a helpline where you can reach us on. Okay. It's 080-5820-6916. I'll take that again. Okay. 080-5820-6916. That's the hepatitis helpline where people can call in and that have viral hepatitis. What can we do? We refer them to gastros all around, you know, and people can support us by donating to us at Seham Healthcare Foundation. We have a Zenith Bank account. people can support the cause. When we want to move from state to state, communities to communities, and set up a community program. So our intention is to set up a community program in Ile-Ife, where we started this major advocacy campaign, because that's like our first major event since 2009. WHO wants to eradicate viral hepatitis by the year 2030. So we want to join the cause by helping well-meaning Nigerians to write their names in gold on the liver of people living with viral hepatitis. Oh. So we say, let us write your name in gold on their liver. Wow. It's our focus, it's our future, and thereby setting up a community office campaign program, in every community that we go.
Now, I have been having this interesting chat with Princess Adepeju Hameed, and she's the founder of Seham Healthcare Foundation. They are advocating for the eradication of hepatitis B in Nigeria, and I'm sure all over the world. If you can manage that as well. Yes. Thank you so much for coming on the show.
Thank you, Aanu. Thank you so much for having us. Yes. We would like you to also join our campaign program.
Okay.
This is a pillow. It's an advocacy pillow.
Okay.
World Hepatitis Day is being celebrated every 28th of July. Okay. So we at Seham, we're collectively caring for your liver and the liver of our viewers, and also taking care of your well-being. So we want you to have this as our advocacy
I will cherish
gift.
It, and I will make sure that I continue to advocate for her.
Then we also have our t-shirt that says hepatitis, know it, confront it, eliminate now. This was
part of the campaign t-shirt from Ile-Ife.
Yes.
This is really beautiful. Thank you so much. Thank you so very much. I really appreciate this.
You're welcome.
Well, what I would say is I definitely am going to get myself screened immediately after this interview. It's very important to take care of your health. I am definitely advocating for this.
Thank you, and thank you for having me on the program.
Thank you very much for coming.
Thank you.
All right, then, well, go get yourself, checked and screened to be sure that you are not carrying hepatitis B. It costs less than a lot of things that we buy luxuriously, things we really don't need. This is about checking yourself and preventing, these disease definitely. Now, that is what Seham is doing. They are definitely advocating for hepatitis B eradication in Nigeria. This is still your favorite show on Vox Africa, the 411 with Aanu Michael. I'm going to sign out here now, and I'll be back next week with something new for you. This is all about your health, getting you aware and getting you healthy. Please, please, please don't disregard this interview. Until next time, stay blessed.